Hi, I'm Loretta Bush, President and CEO for Authority Health. September is National Recovery Month, and it is a time for celebrating those people who are recovering from substance use disorder, but also those who work in the profession, those who run 12-step programs, those who run support agencies, those who work in public service organization, and anyone who really contributes to the larger effort of substance abuse recovery. We are very fortunate today to have a person like that with us today. And we are even more fortunate that Mr. Keith Graham works right here at Authority Health. He works as a peer recovery coach, and Keith also supports our medication-assisted therapy program at the Popoff Family Health Center. Keith, thank you for joining me today.
Well, thank you for having me.
It's a pleasure.
It is always a pleasure.
All right.
Thank you.
So Keith, why don't we start off by talking about a little bit about your own personal recovery journey, and then tell us about your work at the Popoff Family Health Center.
My journey took place about 12 years ago, being addicted to drugs and alcohol for 30 years. I'm now 60, and I'm glad to say that. My journey took off in the arena of the past 12 years of walking in sobriety, long-term sobriety, to where I begin to put the attributes together of becoming a peer coach. And now that I'm certified as a certified peer recovery mentor and drug abuse specialist, as well as a community health worker working alongside Popoff with Detroit-Wayne County Authority. My position there at Popoff is that I am just that, a certified peer recovery coach in the arena to where I work with those that are struggling in drug and alcohol. We have two great programs that are going on. We work well with the 36th District Court to where we assist them through the referrals that come through our agency in the arena wanting that help, part of that specialty court program. Also working alongside the MAT, which is the medical assisted therapy program that is working very, very well, to where we're able to assist those who have been part of the medication therapy program to help them with the groups as well as with one-on-ones, the things that I do there in the arena of giving my own lived experience as well as the training that I've learned for the past 6 years. And it is exciting. You've got to come by. You've got to come by.
Awesome. So we're going to talk about some of those things more in depth in just a minute. But let's talk about this whole celebrating Recovery Month for just a moment. So it is an opportunity to increase awareness and the understanding of substance use disorder, and also to encourage those who need help to seek treatment. So Keith, talk to us about your experience in how is that done, and what can we do to reach more people and encourage more people and really raise more awareness about recovery and how people might seek help?
Well, that's a great question. I'm glad that you brought that up too. Dealing with the stigmatism that those that are still struggling in recovery, whether it be drugs or alcohol, it's the same thing. Our job as those that are in long-term sobriety as well as in the profession of this is that we have to embrace people where they're at.
Yes.
In the arena of not being critical, not being judgmental, but reaching them so we can teach them that they can live a better life in the arena of getting their life back. What I usually do is that I give my own lived experience in the arena that I help the client and I guide them as a ready ruler in the arena of helping them to see past their downfalls, their down settings, stop being critical or judgmental in the arena of the streets have already beat them up. So what I do is I tell them or I ask them, what does recovery mean to you? And it takes a little while when we deal with 5 stages of changes, when you're dealing with the pre-contemplation, contemplation, preparation, action and maintenance stage, and sometimes even relapse stage, which is part of the medical model. We have to find out where the client is when they're ready to do so. What stage are they in? So then I give them homework and I tell them, what does recovery mean to you? And you have to make recovery your own. You have to embrace it to be able to experience the fact that you're getting your life back. And that's what recovery is. You're getting your life back. You're getting the trust back with your family. You're making yourself responsible, and you're making yourself a person in society again that can be used to help someone else. And that's what recovery is all about.
That is so exciting. And Keith, you talk about it with such passion.
Thank you.
And it reminds me of when I first heard about medication-assisted therapy, which has now been about 4 years ago. And I would hear the stories of people who were on medication-assisted therapy. And it was exactly what you just said. They talked about, I got my life back. I got my spouse back. I got my job back. I got my dignity back. I found myself again. And so you're saying exactly those same things. And it sounds like that's what you use in your role of coaching, because that was going to be my next question. What is this coaching about, and how do you really coach someone in their recovery?
Well, and that's another great question too, Loretta. Thank you so much for that. In the arena of being a coach, you have to understand that word coach is just to do that. You have to coach the individual, but you got to meet them where they're at.
Yeah.
You've got to win their trust. You can't be the one that is dealing with the critical side or being crucial or being judgmental. You help the patient or the client to see that they can get their lives back by a lived example. That's what a real coach does. A real coach comes alongside in the arena to assist those that really want their lives back. And it's a process. You have to be patient. It didn't take overnight for them to lose everything, and I can sure say that for me after a 30-year addiction. It takes time.
Yeah.
So you have to be patient. You have to be compassionate. You have to learn how to set healthy boundaries for you as well as for the person that we are serving.
Mm-hmm. So in your experience and in your work with patients or clients, and I think it's fair even to say patients sometimes, because this is indeed a condition, a disease. It's not a lack of character. It's not a lack of pull yourself up by your bootstraps. It is indeed a medical condition that, thank goodness, people have recognized it as that. So in your work with patients or clients, what are the challenges that they must overcome many times to get to treatment and to begin to feel safe in participating in treatment?
That's a great question too, and you're hitting it right on the nose, because this takes me back even in my own lived experience after going through treatments and 7 relapses. And if you understand what a relapse is, to where you're not really committed to getting your life back. And that's what it's all about. You have to make a commitment to yourself. I teach 3 principles. You have to be honest. You have to have the open-mindedness and the willingness to apply a new perspective. And when you can get that, you begin to get the dignity back. You begin to see the self-respect, the self-esteem, as well as the self-confidence that you can do this. You can win to get this back, but it takes time. It takes time to do this. So our job is to walk alongside our patients or our clients, understanding that this is a medical model in the arena, that it is a disease, and that we are the ones that can give the antidote if they're willing and if they're ready. So they have to be ready.
Absolutely. So you've mentioned the word relapse a couple of times.
Yes.
And I know that many of our listeners have heard, or maybe they haven't heard, that relapse is a part of recovery.
Yes, it is.
And then you mentioned, even in your own journey, a relapse of, did you say 7 times?
7 times.
7 times. Okay. Well,
Perfect number.
I was getting ready to say the perfect number, and some people say the lucky number 7.
Yes.
Okay, so let's talk about what is what is that phenomena, this relapse being part of recovery? That's a real thing. That's not just a saying. That's a real thing.
Yes.
And that's something that could be and should maybe be expected as part of this journey, right?
You're right, and it needs to be expected, as well as you have to understand in the arena of when you're talking to an individual that has a disease of addiction. It's real. You may have somebody in your home that's having an addiction right now, whether it's alcohol, whether it's gambling, you never know. But we're dealing with things that we're dealing with the emotions, we're dealing with the feelings, we're dealing with the attitude, which may create an inappropriate behavior. A lot of times, and I use my own self-story in the arena, I wasn't ready to deal with my issues. And the issues was my emotions, my feelings, my attitude, which created an inappropriate behavior. But one day when I found out by listening to another client in a therapeutic setting, she sounded just like me.
Okay.
To where I heard my attitude, I heard my emotions, I heard my feelings, I heard my inappropriate behavior, to where a light went on and I said, wait a minute, I've been wrong instead of they've been wrong. My whole thing of it was blaming everybody for my issues because I didn't understand the decisions that I made. I'm responsible for those decisions. Mm-hmm. So when we're dealing with people that's dealing with relapse, they have to be ready. And unfortunately, a client or patient is not really seeing it yet until they have hit the road and fallen again. And the great thing about it is if they're able to recover from that fall, then they can learn from it, because that's what relapse is all about. It's about learning. It's not about degrading or making you feel guilty or ashamed that you didn't accomplish this. No, we need to stay at work with this. And that's what relapse is.
Absolutely.
Absolutely.
So Keith, let's stay on that path, but change gears maybe just a little bit. And that is one of the things that I've always utilized in my career in working with populations is recognizing that no matter what the community is that I'm working with, each community, each patient, each client may come with a multitude of issues or problems, but they also come with strengths.
Yes.
Each community comes with strengths, these innate strengths, and that we have to identify and tap into those strengths in order to help them create a meaningful life and sustain behavior change. In this case, we're talking about recovery, but it may be behavior change in other areas. Tell us about how you've been able to work with your clients in helping them achieve that, tapping into those strengths so that they can identify those innate strengths in themselves and help for them to be able to maintain behavior change.
Okay. The thing of it is that all of us as human beings, we have such a wonderful gift on the inside of us, which is called resilience. Mm-hmm. When we begin to help someone, as we know the experience that we had, that somebody helped us, our job is to help build the confidence in the patient or in the client that we are serving, to help them to pull on the resilience, and then to help them to see past the what if, to help them to see past their failures, to help them to see past what I don't have and what I lost. Let's talk about the strength part. Let's not talk about the weakness. Let's talk about what I see in you, that I'm trying to help you to see this, that you have a strength, a resilience on the inside just needs to be dusted off, and that you need to find your niche, set your pace, and get in the race of your recovery. And that's the powerful piece about strength, dealing with resilience that we all have. We just have to be helpers one to another. And I think that's a powerful piece.
It's a powerful piece.
Yeah.
So, Keith, both you and I have used the term medication-assisted therapy. Yes. So at this point, our listeners may be wondering, what exactly is medication-assisted therapy? And, really, let's take our time and describe that to the listeners, because as I mentioned earlier, when I became aware of medication-assisted therapy and what it was doing for patients and clients all around the state, I was so excited, very pleased to be able to incorporate that in our work here at Authority Health and at the Popoff Family Health Center.
Yes.
So let's make sure that our listeners understand what that is, and that it is something that's available not only for those who are addicted to opioids, but also to alcohol. So you're part of our medication-assisted therapy team.
Yes.
So why don't you take some time and talk about how that all works?
Okay, thank you so much. When you're dealing with MAT, which is the Medication Assisted Therapy Program, it's dealing with a harm reduction program. A lot of patients, they don't have that strength yet to be able to do it on their own. So what is offered is the medication that helps take away the craving, takes away the trigger as well, give them the stability that they need. And it comes in a variety, but the wonderful thing at Popoff is that we have an MAT doctor who is able to, as you would say, we have a mom and pop shop to where the physician is able to physically as well do an exam, as well as we do labs as well, to where we're even helping the patient that needs this assistance in the arena of, once it is applied, it helps curb the craving and the trigger. I tell my clients all the time that whatever you're thinking about, that's the attention that you're giving. So if you're thinking about it all the time, that door opens for the craving. Next thing you know, here comes the trigger, because life happens 365, 24/7, anything can go wrong. So with that MAT in place as harm reduction, it helps give the stability to the patient that really wants recovery, really wants to get their life back. And it's been very successful at Popoff. And I'm enjoying being a part of that team.
Absolutely. And,
Absolutely.
Keith, I think that, that was the exciting part about it when I first learned about it. It can be given in injection form.
Yes.
It can be given in pill form. It can be given as a strip on the tongue. But the key part that you've said is that this whole fixating or thinking about the drug chasing, it actually changes that part in the brain that's constantly seeking or thinking about the drug, and it enables that part of the brain to settle down so that people are actually able to sink into their recovery. And at Popoff, and where we found the research has shown it works best with counseling, and that's
Yes.
where you come in. So it's not just the injection, the pill, or the strip. It's about also the talking and being able to understand what kinds of life situations may have led to the addiction and aid in the recovery.
Yeah.
But I absolutely love the fact that it is that aid that keeps
Yes,
that
yes,
really settles down that part where we're constantly thinking about it. And and I think that many of our listeners can relate to that. If you've ever been on a diet,
Yes.
and the minute you go on the diet, all you think about is the ice cream sundae.
And chocolate chip cookies.
And chocolate chip cookies.
Yes.
That's all of a sudden, that's all you can think about. Or like today, the bag of potato chips and lemonade that I had for lunch. It's all you can, think about. So if you can settle that down, then you can start to really think about what's next in your
Exactly.
life.
Yeah.
Well, I'm excited because September is National Recovery Month. The theme this month is recovery is for everyone, every person, every family, and every community. Today we're talking to Keith Graham. He's Authority Health's peer recovery coach at the Popoff Family Health Center. He works with our medication-assisted therapy program. And what's important for you to know is that if you have a friend, a family member, or you yourself, if you could benefit from recovery services, feel free to give us a call at the Popoff Family Health Center at 313-824-1000. Push prompt number 1 where you'll reach the Popoff Family Health Center, and then ask for Keith. And then he will be able to assist you, friend, family member, on your road to recovery. Now, Keith, we've been talking about those folks who, kind of recognize, there's a problem, an issue, want to start on their journey to recovery. But what happens if you're working with a client and then that client says or decides, you know what, I don't want to continue in treatment. Time for me to stop. I just don't think I can do this, or don't want to do it. Does that ever happen? And then when that happens, what do? Do you say, okay, come back when you no longer want to get high or be drunk anymore? Or what do you do when that happens? Have you seen that along this journey?
I have seen that a lot along this journey, Loretta, in the arena that, you find out that when a client or a patient is tired. And I get it because I've been there before too. You're tired of coming to group. You're tired of taking this medication. You're just flat out tired.
Yeah.
But here it is that our job, again, as a guiding light, as a peer coach, my job is to listen. And I think that it's so important that we have an active listening skill to find out what the client or the patient is really saying. In the arena of, I want to go to the root issue of why you made this decision. My thing of it is, I don't want to talk you out of it. I want you to hear the reason why you want to stop getting the treatment that you need. And in most cases, when we're dealing with that interaction with a patient or with a client, they hear themselves and they begin to really share what's really going on.
Yeah.
Well, you know, it's interfering with my job, and you know, I can't go to the parties anymore, and I can't go around my friends anymore and all of that. And then we begin to say, well, listen, let's take a thought for a moment. Let's step out of the frame of our life for a moment. Let's look the whole thing over like you're going to the movies. The last time you got high, you're the main character in the movie. You might as well get some popcorn. You might as well get some chips and the lemonade and sit there and watch the whole deal, wait for the credits, and then when you get to the end, then make the decision. Because now you're looking at the reflective piece on the last time you got high and how did that turn out.
Yeah.
It may be a different time and story, but it's always going to be the same results. And then, and only then, they're able to make the decision of, you know what, I'm going to hang in there for a little while. Thank you for talking. I didn't see it like that.
Yeah.
My thing of it is just to help. And that's what I think that is so important about us that are in the field of this treatment, understanding the addiction, understanding that each and every person, I don't mean to be long-winded, each and every person each and every person has their own unique character, and we have to see them in their uniqueness to help them to see their strengths and then walk with them.
Right.
That's recovery.
Yeah. Well, and I tell you, Keith, and I think that, you know, that's really the benefit of when someone has a recovery coach working with them who has the lived experience, who can speak from the perspective that you can. Because, you know, when I asked you that question, I was waiting with bated breath on what would that answer be, because I consider that a hard question. And the answer that you gave was really right on point. And I think that one that really can only be answered by someone who's, you know, walked that walk and, you know, gotten to that, seen that point before, not only for themselves, but in many clients that you have helped.
Oh, yeah.
Well, we are coming to the end, and so I know it just went by really, really quick.
It's still the full month, though.
Yeah, it's still the full month,
yes.
But we may be at the end of this conversation, but certainly not at the end of this particular journey in helping people get on the path to recovery. And, you know, when someone has fought the good fight relative to other diseases like cancer, heart disease, or diabetes, and they find themselves in remission or they've controlled their disease, you know what we do? We celebrate.
Yes, we do.
And that's exactly what we are doing in this month of September, and really all throughout time. We are celebrating those who recognize that they have an addiction and they have put their feet on the path of recovery.
Yes.
And we want to thank you, Keith, not only for being my guest today, but for all of the work that you do to help people get their life back, get their dignity back, get their jobs back, get all of what drugs and alcohol has taken from them.
Yes.
Keith, would you like to have any final words?
Yeah, I would like to say one last thing. Addiction. This is Recovery Month, and it's so important. You may have a loved one in your home, in your community, even on the job. You have to see where they are, and that you have to allow them to come to you. So many times I remember when I was in recovery, and then my first stages, that everyone was telling me what I needed, what I needed, what I needed. We just need to come alongside and show them that we love you, not by words, but by actions, and then wait on them to get ready. That's what I think we need to do.
Absolutely. Thank you so much. There you have it. Let's celebrate recovery. I'll see you next month.